So this is how I ended up landing on the PA profession versus physical therapy. Hey, my name is Brandon and I'm a new grad PA working in neurosurgery. If you like this content and want to see more, feel free to hit that follow button. So in undergrad, I was an applied physiology and kinesiology major, APK, at the University of Florida. Essentially, it's an exercise physiology degree where I'm learning a lot about anatomy, exercise prescription, exercise physiology, etc. So in my degree, I would say the overwhelming majority were pre-PT students. However, I was one of the pre-med students along with some of the other classmates I had. There were some pre-PAs thrown in there, but I would say the majority of people were attempting to go to physical therapy school. Even though I've had a passion for health, fitness, and nutrition for about 15 years now, I've also had such an appreciation for the human body as a whole, so every single organ system. Now, when you're going down the physical therapy route, at least to my knowledge, your main focus would be the musculoskeletal system, the nervous system, as well as some of the associated symptoms that could otherwise help with kinesiology, human movement, as well as the physiology, but it doesn't dive deeper into every realm of medicine. So if you are interested in things like the heart or the brain, the lungs, the skin, there are a lot more opportunities to dive deeper into the educational aspect of medicine by going pre-med, nursing, NP, pre-PA. So there's just more variety as to what you can learn and potentially do with your future patients if you decide to go to like PA school. As someone who works with both brain and spine patients, I have the pleasure of working with a lot of great PTs and OTs. All of them are super smart. All of them are super helpful in trying to give that disposition to the patient after they have some type of surgery or they just need evaluation. So I can't speak on physical therapy school because I've never looked into it and I just really don't know the curriculum. However, I do have a lot of friends who graduated with their PT degree and now they're physical therapists and absolutely love it. So if you like the musculoskeletal system, the nervous system, human movement, fitness, anything related to just human activity, I think the physical therapy route could be a good option. However, if you are interested in learning more about like the heart, the lungs, just the entire human body and different organ systems, then you may want to look towards something like nursing or physician assistant, nurse practitioner, medical school. That'll dive deeper into more of an overall look of the human body. That's not to say this stuff isn't considered when you do a PT evaluation. They quite literally are the masters behind kinesiology, human movement. When someone has an injury or an accident, they are the ones to ultimately help these patients get back to their normal selves. So with that being said, shout out to all the awesome PTs out there. I really appreciate what you guys do to help the continuity of care for my patients. I have a lot of great friends who are awesome PTs. I work with a lot of amazing PTs in my hospital system, as well as referring patients out to some awesome PTs who I always get positive feedback from the patient when I follow up them. So I hope that helps distinguish the difference between PT school and PA school and kind of why I decided on one route versus the other. If you have any more questions, feel free to drop a comment down below or send me a DM. Have a great rest of your Friday and enjoy your weekend.